Okay, so this is the lower extremity inspection. So first, I have you on my modified chiropractic table, which is a lazy boy recliner. So first I'm going to inspect the skin all the way up from the iliolingual ligament all the way down to the top of the foot, the bottom of the foot, and in between the toes. I'm looking at the lateral side and the medial side, and then underneath too, looking for any lesions of the skin, any changes in hair pattern, especially over the tibial surface, as that would indicate an arterial perfusion insufficiency. I'm looking for any brawny edema in the ankles that would indicate some kind of peripheral vascular disease. I'm going to inspect the toes specifically, looking at the color of the nails and in between the toes. I'm going to do the nail compression test, which is blanching them, making sure they fill back with blood quickly. You have some nail coloring on, but I'm not suspicious of anything, so that's okay. So next I'm going to go ahead and go into palpation. So first I'm going to palpate the dorsal pedis artery, which is right along the extensor hallucis tendon. And I'm going to feel that bilaterally to make sure that they're similar and have a good pulse. And then next I'm going to move on to the posterior tibial artery. And those are good, strong pulse at the same time. And this one you can't really check bilaterally, the popliteal artery, so I'm just going to do one at a time. And this might tickle a little bit. Just have you relax. So then right away I would go and check the other side and make sure that they feel similar to me. Okay, and that's good. And next I'm going to check the femoral artery. So I'm going to go from your ASIS and can have you find your pubic bone. So I'm going to go about halfway in between there, and that's the femoral artery. And then my middle finger would be the nerve, it would be nerve, artery, vein, and then lymphatics. So once I palpate the artery, I would do that on both sides. And then while I'm in the area, I'm going to feel for the lymph nodes by going superior, and circular motions, going inferior a little bit, medial and lateral. And I can also check for a hernia, which would be over the vein, by having you look that way and just give me a good cough. Okay, and I would check that on both sides. And then I don't have my stethoscope, but I would auscultate the femoral artery too, listening for any bruise, which would indicate sclerosis of the femoral artery or the iliacus artery. And now I can do some special tests of the leg. So I'm going to do Homan's sign, which I'm just going to have you lift your leg 45 degrees up. And this would be if I suspected thrombophlebitis. And I would squeeze the calf. And does that hurt at all? Mm-hmm. If that didn't hurt and I still suspected, I would dorsiflex the foot and then squeeze too, and be looking to reciprocate some pain. And in order to let me know if I would suspect that, I would also check both legs bilaterally for temperature changes. And if there's some local warmth, especially around the calves, then that would be indicative of like a deep vein thrombosis or compartment syndrome. So that was good. Next, I'm going to do the leg raise test. So I'm going to raise both of your feet up and have you kind of paddle your feet and kick really quickly. And then I would do this for about 60 seconds, but since we're limited on time, I'm just going to drop it and then have you put your feet flat on the ground and look for the blood to return, which it does nicely. And And then one more test. I can have you stand up for me. So now I'm going to check the great saphenous vein and just tap up above it a couple inches and feel for any backflow of blood that would indicate a valvular problem. And that is the lower extremity examination.